All right, guys, now we're going to move on to ligaments of the knee. And depending now what Ian here is going to tell me about, I did ask him about if he had any past ligament issues of any knee. And you said it was the right MCL.
Correct.
Right? So we're going to look at the MCL. And to save us time, guys, the same exact techniques I'll apply for LCL as well. Those are the two common knee ligaments that you're able to do manual therapy on. When it comes to ACL or PCL, very hard because that ligament is within the knee joint and it's very hard to spread, or not very hard, just impossible to either pin or even spread. So we're going to go to the most common ones that I tend to use, MCL or LCL, but in Ian's case, we're going to do mostly now the MCL. So before we do any techniques here to see which one's best for him, we'll do a little bit of range of motion testing on him, see what he feels stiff in his squat, for example, or his squat quality. We can actually check out neighboring areas as well. So any knee pain at all today?
No.
No? Why don't you check, how about you check your rotations, trunk rotations, feet are on the floor, just make sure they don't come off. You can move your hips with you. And let's see, that's to the left and to the right, a little stuck to the right. Yeah, so he is a little stuck going to his right. What about side bends, left and right? Notice which side feels tighter than the other. That's to the right, okay.
Going towards my right.
Going to the right. How about you check your squat? Let's see, you can try like 3 reps, slow, notice the depth. Notice if you feel tightness anywhere.
It does feel sticky.
Sticky on the right knee?
Yeah.
Yeah. Try it one more time. Okay.
It feels like there's pressure.
Pressure. So he's getting a sensation of pressure on his knee when he's squatting. And mind you now, Ian, he's a big time Olympic weightlifter, so he does a lot of snatches, clean and jerks. So this might be something that can hinder him from his performance. So again, we're going to be addressing now is his MCL, since he has a history with that. Ian, I want you to face this way, and if you can get me into a lunge, right leg forward, left foot back. I can go a little more this way. Okay, so I'm going to be on this side so you guys can see the placement I'm going to have for his MCL. So let's actually keep this in extension. So when it comes to the MCL, what you would like to find first is the tibial-femoral space. So if you run fingers, feeling the gapping, right around there. Can you just move the knee a little forward and back for me? That's it, yeah. So I found his tibial-femoral space, right? So femur, yes, femur, tibia. You're gonna feel that gap between, and if you're unsure, ask your client to just do a little bit of knee forward flexion forward and back, and you'll feel the two heads of the femur and the tibia moving, and you should be able to find that tibial-femoral space. Now, if you go medial condyle of the femur, so I'm going to go superior to that, and you can actually feel a taut band on that tibial-femoral space, and that's his MCL. So I go superior to that. You okay so far? Mm-hmm. Right? And I can feel the edge of the femoral, the medial condyle, and I'll have one finger right there. And the MCL is not a straight down ligament. It's a little bit oblique when it goes to the tibia. So again, I'll find the tibial-femoral space, move inferiorly, and a little bit more towards the tibia, and we're right there. So now what we're going to do is the pinning technique. So I pin both ends of the MCL, and what I'm going to ask now from Ian is to give me as much full range of motion of knee flexion forward into full knee extension. So see if you can bend that knee as far forward as it goes, and I'm following him and back. We're only going to do about 5 reps. Good, full knee extension. and I'm following him. And here for this, guys, you do not need your chopsticks because it's a quite large ligament. And again, do it one more time. And we're there. So that was your pinning technique, right? Hopefully that made sense. You don't have to be crazy specific on the ligament, but try and get as specific as you possibly can. So from that, we'll reassess. Let's check those trunk twists, side bends. Let's see if there's any change. Better to your left and better to the right. So it's a lot more range. Let's see side bends. Still better to that left. Yeah, pretty good.
Mm-hmm.
Let's check that squat now. Hey, how did that feel now?
Way smoother.
Smoother.
There's no pressure at the bottom of the movement.
All right. So far they gave us some promising results. Again, for shits and giggles, let's see what happens with spreading to see which one's the best. Same position for me, man. All right, so again, find that tibiofemoral space. And we're right there. So again, I had to pin this way. Spreading is just between as the ligament goes vertically. I go in between the ligament, add a little pressure and spread skin and fascia as Ian goes again into full knee flexion and full extension. One. And again. Two. So you have to follow your athlete as he goes through the motions. And two more, man. And because my fingers are a little bit slippery right now, it's just constantly reposition my fingers. One more time, buddy. Forward and back. Beautiful. All right. And reassess that. Better, worse, or same. Okay. I'd say that's probably better than before. Okay. Squat. And how about now? Does that feel still just as smooth or did it get tighter?
It looked the same.
Same. So not really a big change, right?
Not really a big change.
So either one, I did notice one small thing with his left rotation. It did look a little bit tighter to me, per se, because looking at him from this angle, I saw how far his arms went to his left. So I'd probably opt to have him do the pinning technique on himself to make sure that he gets the best result. So again, we did a spreading. Let's do the rotations again, but Ian, see if you can face that way and show me those trunk twists. That's to his left, and that's to his right. So that's after now spreading the ligament. We're gonna try the pinning one more time and just reassess again, see if it's better. One more time, man. We'll do about 3 reps. So fine, I'm good. So there. Feel that top band, and we're right there. And a little inferior. Boom, and just give me 3 reps. Full knee bend, full knee extend, full knee bend, full knee extend. And one more time, nice full range of motion there. There we go. And there, good. And show me those trunk twists still facing that way. Yeah, that's better. Yeah. So as you guys have seen, his rotations improved. He didn't feel much of a difference whether we're spreading or pinning the ligament when it comes to his squat. But I want to make sure that all other motions were giving him the best result depending on if it was pinning or spreading. So in Ian's case, it would be actually pinning, and he can manually do this by himself before he squats, before he does any kind of athletic activity stuff. And the more he does this, the more he really won't need to be able to do this constant technique over and over again. Because again, he's creating neuroplastic changes if he's doing it frequently throughout the day. If not frequently throughout the day, at least before his training, but it will probably take him a longer time for it to be solidified, for it to stay like that forever. So this is something that he can easily do with his own thumbs. All I have to show him is where to place his thumbs. Do that before his lifting, and he should be pretty much good, hopefully. So that was going to be your MCL ligament. To save time, guys, the same thing you will do for an LCL. All you got to know is your anatomy. Find the tibiofemoral space, pin the ends of that LCL, reassess. No change, spread. Notice if there was a change there. Whichever one gave you the best result, you opt for that. So whatever I did to that MCL is the same thing you do to the LCL. Just read your anatomy. Have a picture right in front of you so you can kind of ballpark where that LCL is. And you can pretty much easily feel it, as well as the MCL. They feel like guitar strings. So give it a shot, guys. This was pretty easy. You don't need chopsticks for this. Take it away.